for the opportunity. My name is Susan Kunz, and I'm the Chief of the Health and Wellness Department here at Mariposa Community Health Center. The department's best known as Platicamos Salud, and it's the community outreach and education arm of the health center, complementing our primary care services. At any one time, we have 25 to 30 grants and contracts that are state, federal, foundation, for a variety of services. We have a range of services, everything from very basic outreach and enrollment and referral to connect people to services they need, have them come here to have a healthcare home or elsewhere, help them get insurance, those types of things, screenings, all the way up to group education classes, individual case management, home visitation, patient navigation, which is helping people with their chronic disease. And we have community health workers now involved as part of the care coordination team with medical doctors. We do community development, media. We're the organization that started the local food system effort, Cosechando Bienestar, with Nogales Community Development, with the farmers market downtown that a lot of you have heard about, and training people how to garden in their backyard and glean food, things like that. So we do a lot of things. We work with children, mothers, teens, seniors. One of our programs that's very unique that a lot of people know about is the Summer Youth Institute, which is we train peer health educators, basically promotores that are teenagers, to be mentors to their friends and colleagues. So we do a lot of stuff that makes it very fun. We're always adding programs. Being mostly grant funded, that's a challenge because grants always end. And so we try to continue programs that we know are good, even if we don't have the funding. We just try to, stretch resources, like our learning center downtown. Often the funding for that center is very short, but we use a lot of volunteers to operate this center. And we're always looking for funding, to renew something, keep it going, start new services. Well, for example, we've worked with women with breast cancer for many years and helping them deal with the emotional strain of going through treatment for that. And also we have a support group of women that help each other, because not all women survive, and so they help each other. We access a lot of free services for them, or low-cost services, and also prosthetics and wigs, things like that they need, so they can feel better about themselves. In fact, I was just looking today, there's a photographer and folks who do makeup. They come and do this for free with the women to help them feel better about themselves. And then they take photographs. It's really very beautiful. These are women that have lost their hair and have had mastectomies, and they're dealing with the whole body image. We work a lot on diabetes. We have classes, 2 of which are at the Mexican consulate, for healthy lifestyle, healthy eating, active living. And then besides the didactic part, learning those things, there's an exercise component, and there's also a special day that we offer yoga, which we've learned that yoga, a lot of people hear it and they think it sounds like kind of new age, but it's really just very relaxing and helps people be flexible and move. And you'd be surprised how many people enjoy yoga. They think that they wouldn't like that. We have the Summer Youth Institute that we've talked about, that I think we're the only place in the country that I know of, and many other organizations have asked us to share the model of the idea of, if we're having adult promotores de salud, why not teenage promotores de salud? And we all know that we're all influenced by our peers, but especially young people. And so every year we train 20 to 24, last year we actually trained 30, young people who are high school students locally. And then after that 7-week program, they're certified as teen health facilitators. We hire some part-time throughout the year to help us with outreach and events. And then, but they're also supposed to be on their own, being peer educators at their schools and families and friends. So that's a really neat program that we're always looking for support for that, because that's the kind of program that whether we have funding for or not, we're going to continue to do it because of the demand. We often get more than 100 students applying for the 20 slots. And it's very effective. And a lot of those young people are going on to health careers as well and getting amazing scholarships. Well, we've been increasingly integrating the department with the health center, because we were sort of separate for many years, part of the organization, but we're trying to be more integrated so that our primary care includes all of the community-based services that we have, that we can go to a patient's home, but we can also really help people address other parts of their lives that impact their health. They're called social determinants of health. Do they have a job? Are they earning a livable wage? Do they have the education to do that? Are they a U.S. citizen, which may or may not which definitely affects whether they have health insurance and access to care. So that's why we have services like our Family Learning Center, the Mariposa Family Learning Center downtown, where we offer parenting services. These are services for parents of children 0 to 10, but we're also trying to help the parents. Because as you can imagine, say you have a parent of a young child that doesn't speak English well, that parent probably doesn't feel very confident to go speak to their child's teacher or counselor, for example. So we're helping families like that learn English, become US citizens, get their GED, and learn basic computing. And we offer all those courses for free. We collaborate with Nogales Community Development. They're helping us a lot on the computing course. And many of these classes are taught by volunteers. There are an amazing number of retired people in the community that are coming to teach that are retired educators. And it's really, really nice because we see, especially young women, single mothers, building their confidence and improving their quality of life because they can get a better job, or they become a citizen and now they have insurance and things like that. So we like to really keep doing those types of services because, we can tell, say you have diabetes, we can talk to you about you should not fry your food, you should, bake or steam your food. But if you visit someone in their home, they don't have an oven. All they have is a fry pan. They don't know how to cook that way, and so they need to learn that, and they need to have the ability, they need the access to healthy food, which is partly why we worked with Nogales Community Development and Avalon Gardens to start the Mercado downtown, the Nogales Mercado, so that local growers, instead of going to Tucson to sell their food at farmers markets, they're selling it here. And lots of local folks are now selling processed food, so they're actually gaining income from the products they're producing, like eggs or salsas, tortillas, things like that. So we're just, again, we can talk about good nutrition, but if people don't have access to affordable, fresh, healthy food, then they may continue to eat foods that are high in fat, sugar, and salt that are, maybe they even know they're not good for them, but they don't have an alternative. One of the things everyone at Mariposa is working on is healthy weight, healthy eating and being physically active. Just like around the country, too many of us are not active and we're overweight, we don't eat well. That's even higher among Hispanics in the United States and Hispanics in the border region. And so in our community, it's definitely the case that many of the chronic diseases that folks are coming to the health center for, that they're being treated for, have to do with those things. And so, we're very supportive of, there's an initiative locally right now to try to get bike lanes along Grand Avenue and along Mariposa Road. Mm-hmm. And so we actually mobilized to help encourage the community to let their voice be heard at the city council about that. We're trying to work on walkability, and again, more healthy foods being available, and nutrition education, working with Head Start parents and going to the schools doing nutrition, and working with seniors at the senior centers about, trying to eat healthier. So we're all working on it. We're doing those types of things. Our healthcare providers are doing a coordinated care model so that our community health workers are involved, the medical assistant, the doctor, so everyone is giving a similar message to our patient. And if we have a patient with uncontrolled diabetes or high blood pressure, in addition to their medical appointment, our community health worker can visit them in the home and help them understand how to monitor their blood sugar. Spend some time with them in their kitchen, look in their cupboards, see how they cook, help them with that, do home safety and prevent falls, all those kinds of things. We're really excited. Mariposa owns the building that the clinic is in Rio Rico, and is going to, over the next year or so, be filling the complete building. Part of that space now is a brand new office for some staff from Platicamos Salud. We just opened last week. We have about 8 staff up there. And the idea is that we want to serve North County better. Rio Rico is growing faster than Nogales, and about half of the population is in the North County. And so the staff we have, the maternal child health case managers that do home visitation, they can go from there directly to homes in North County rather than driving all the way from here. We have a really nice new classroom, conference room there, so we can do classes, but also meeting spaces really at a premium in Rio Rico, so other organizations can use that space. So it's an example of how we're really trying to grow where the need is. We always have a main campus here, but our services are going to expand in Rio Rico. They're going to be adding more medical providers very soon. And then in Patagonia, we also have a health center, and we're looking at how we want to grow and adapt that health center out there. But we're just really happy to have some staff up in Rio Rico now for Platicamos Salud. So we're going to probably have some kind of opening or celebration there in the next few weeks so that the community is aware that we're there and they can start to take advantage of the space. And even like for WIC, for example, we have a lot of clients who are from Rio Rico. They can get services there now, for example, instead of driving to Nogales. All the services we have for Platicamos Salud, for health and wellness, are free. You don't have to be a health center patient. To be a health center patient, of course, you do need to have some form of insurance, or we have a really good sliding fee scale program with very low co-pays fees for services that individuals without insurance can sign up for and get based on their income. So there's something for everybody, but it is important for people to know you don't have to be a Mariposa patient to participate in one of our classes. For example, we offer prenatal classes in concert with the hospital and with child and family resources, and we teach that together. And so whether you're going to an obstetrician in the community who's not from Mariposa, or you are, or even going to Tucson, you can take your prenatal class here locally with us. No fee. We have breastfeeding support groups, no fee. Really, all of our classes are free. The only program we have in this department that does have some eligibility criteria that are income related is WIC. But even WIC is a higher income than most people think. It's 185% of poverty level income, so a very large number of people qualify. WIC is really a nutrition education program. So again, more people might want to seek it out because you can get really expert breastfeeding support. We have hospital grade breast pumps we give out to women, really good infant feeding advice and how to feed your young children. Because again, obesity starts in childhood. I've been working in public health before I knew what public health was. I went into the Peace Corps after college and started thinking that I liked working in the health field, but not in a clinic. I liked being in the community, doing education, connecting resources to and needs. And after Peace Corps, I worked for the Tanauta Nation, which is an Indian tribe west of Tucson. Then I switched to working on border health because I spoke Spanish and wasn't really utilizing that capacity. And I worked at and then directed the Border Health Foundation. After that, I had my own consulting business for about 10 years, doing similar work, designing programs, writing grants to fund programs, doing evaluation and training. And in 2007, I had the opportunity to come work here. And my husband and I already owned property in the county. We wanted to come live in Santa Cruz County. And so I was delighted to be able to have employment here. And so we moved down here then, and we've been here ever since, and we plan to stay. Yeah, we have children in Tucson. We still own a home there that we rent. And every once in a while, people say, "Oh, come back." And we're like, "No, we like it." We live near Tumacacri, actually, but I work here and we really enjoy it. I love the history here, the culture, the climate. I think the border environment is very interesting, and just the natural beauty. It's very, very nice. When I was a child, I had a little outfit, and I would, say, "Mom, iron my nurse outfit," and I would wear it. My sisters would make fun of me. But I do have a godmother who was Native American that was had a lot of passion, and she encouraged me to do what I like to do, and said it was very important to be kind and give. And I've worked with a lot of very amazing people. A woman named Sylvia Para, who was my mentor at the Tanauta Nation when I worked there. Jill Sapien at the University of Arizona. And these are people that, really are committed to bettering the quality of life in the community, and can show that it's important to do work that you love and make a difference. And I learned early on that I like writing grants. I didn't think I would ever say that. I enjoy trying to find funding to meet needs, and sometimes it's very stressful, but I sort of have found my niche in that, and I enjoy program development. That's a lot of what I do here, and I enjoy mentoring other people on how to do that, because in our world, if you can help find resources, it's you come in handy.